Good morning. Hi, everybody. Thank you very much for joining us again on the Saturday busy schedule. It was nice to see some of you from United States, like Los Angeles, Tommy Yee, and coming back to attend our webinar. I think there's some people from Philippines. Nalia, thank you very much. And today is actually will be a very exciting webinar. Actually, liver is a very important organ for us. And I think some of the things that we need to understand is why liver is so important and how can you prevent any kind of liver disease. And so today will be actually is a very good webinar. I saw some people from also Facebook joining us. That was really nice. I think Pat was there. And so quite a few people actually. And we have people from Los Angeles, Vancouver, Hawaii, and various different places. Hi， 各位朋友，我係 Andrew Lau 啊，老師 President 你好。今日咧呢個係一個好重要嘅題目，因為好多人咧都唔明白，原來咧係如果糖尿病咧係可以影響你個肝嘅喎。咁原來肝咧係有咩問題咧？咁好多人都未必知道嘅。咁但係變咗嚟講咧，我如果要知道咗之後咧，就可以更加係理想多啲啦。咁能夠即係保護你個肝係點解會保護你肝係咁重要咧？咁呢個係一個即係我覺得係好重要嘅題目啦。咁變咗嚟講，你大家了解咧，就最低限度早啲防禦到你啲嘢咧，係唔會影響你肝臟，因為個肝壞咗之後咧就好難好得翻嘅。Okay, good. So I'm going to start off, without further delay, I will start off my program. All right. So I have a lot of people who are some names that I don't recognize. So I thought that maybe perhaps I need to go through a little bit, helping fastly people understand what is diabetes and why we're doing all this. So I will give about 7 minutes or so to able to do this. Okay. First of all, as you know, diabetic, you don't get well. This is a chronic disease, it's a lifetime disease. You really need all the might to help you to prevent get worse. You can control basically. And what we'll not talk about is how do you control is actually lower your blood sugar. And actually to do that, you need several things. The diet control is very important. Your exercise is very important. Your weight control is important. And then, so in your diet, you have to actually limit all the white food, soda, and juice. And LOWSUTEA can be very, very helpful. A lot of people drank LOWSUTEA now who actually saw the great benefit of LOWSUTEA not getting, blood sugar increase, even though they are taking medication, it's okay. Everybody measure A1C, and we'll talk a little bit more about what is A1C is all about, so you can able to understand. Now, this is a very important slide that I think all of you need to continue to read and remember. The reason is this slides will give you all the understanding how diabetic form and why you have to drink LOWSUTEA way even before your pre-diabetic stage. Because the first stage of diabetes or pre-diabetic is actually your cholesterol LDL goes up. And when the LDL goes up, you know what? It will damage the insulin that come out with the B cell, which is supposed to take the sugar into the cell. And the B cell are damaged, then it doesn't take sugar in the cells. So net result, more and more insulin come out, it doesn't work. But that the condition will come out will be really not good because your sugar goes up, your cholesterol goes up, two things goes up, it make the blood become very thick. And when the blood becomes thick, then it comes to stage 2 because it will start plugging in all the entire body with plaques. And then your blood pressure start going up. Now, this is where everybody should understand. When things start plugging all over your body, maybe the first year, nothing happens. Second year, nothing happens. Third year, nothing happens. But as time goes on, 5 to 10 years, that's where your problem is going to start. And you plug and you're going to start getting problem with eyes. And later on, we'll give you a slide to show you all the complications. That's where you're going to start off the diabetic damaging the entire body. You can't go back to reverse and say, may have a brush or something to clean it up, your vessel. It doesn't work. Once the blood is blood, okay? So that is where you're going to start that journey. That's why you want to actually, if you could, prevent yourself, you move to the third stage, which is your third stage is your A1C start going up. And everybody measure that. What it means is your blood sugar start going up, and the doctor will measure your A1C. And what's that is? A1C is actually a small protein, and basically this protein will have amount of sugar that attach to the protein, and this sugar attached to the protein will be measured by percentage attachment, for example, and it will give you a 3 months average. Okay, like if my blood sugar is 5.7, that means I'm okay, I'm a normal person. If the blood sugar beyond 5.7% to 6.4%, I become a pre-diabetic. If you continue to that pre-diabetic stage, keep moving, and in 3 years, many of these people will convert it to be a diabetic, then become stage 4. And once you become diabetic, doctor will still give you some time. Hey, you know, you are now diabetic, you have a chance to reverse yourself, do it. But in 6 months, you don't reverse. The doctor, and especially your A1C, will get down to 7. You know what? They will give you medication, and you become a permanent diabetic patient forever and ever, and will not reverse. Doctor will not say, okay, even if you get better, they will not say, oh, you're not not diabetic, you're still going to be a diabetes. Okay, so this is one of the 4 stages. So remember this very, very well, because this is everybody basically need to have that in their mind, and so they know this is how the progression of 4 stage of diabetic. 嗱，各位朋友，記住糖尿病咧係唔會好嘅，只係有控制嘅啫。咁當你控制嘅時候咧，就有一個好大嘅問題啦。咁咧，然後咧就點控制啊？原來咧你係要有 diet 啦，要有即係食材啦，weight control 啦，同埋要控制你嘅磅數啦。咁其實控制咧好簡單嘅。其實你就要唔食嗰啲叫碳水化合物，或者唔可以飲soda water 食白嘅麵包啊，所有白粉咧係可以全部咧減咁少得咁少。咁陣間我都會教你多啲要食啲乜嘢嘅。咁但係咧呢個咧係最重要咧，就係一定要有運動啦。其實我哋有好多 program 教點樣運動㗎啦，好方便嘅，即係行就得㗎啦。其實都第二樣嘢咧。就係你去減磅啦，點減磅亦都好簡單嘅東西嘅，咁亦都會有又有 exercise， 但係兩方面做埋咧，你個磅數一定會低嘅。咁所以變咗嚟講，呢個咧我哋有好多 program 教你嘅。咁其實好重要咧，就係呢個 page， 呢個 page 咧係4個 stage， 係點解你要變咗糖尿患病者咧？咁第一個 stage 咧就係當你個膽固醇上升嘅時候咧。就會將嗰個胰島素嘅 B cell 損壞。當胰島素 B cell 損壞嘅時候咧，嗰啲胰島素咧就唔帶翻啲糖入去個細胞裏邊，咁你咪好多糖喺個血管裏邊同埋啲膽固醇一齊啦。當呢兩樣撈埋一齊嘅時候咧，弊啦，因為嗰啲血咧就become好結啦。當啲血結嘅時候咧，就全身係咁塞。咁第二個 stage 嚟喎，咁就係你血壓咧就開始上升。當你上升嘅時候咧，呢個咧就問題認真係大，因為第一年塞冇乜問題，唔係好感覺。第二度塞去咧係10年後咧，咁你個糖尿病嘅情況咧就越整越壞，好多嘅病嘅問題就會出現。一陣間我再解釋有咩問題。咁其實醫生咧就一定係 measure 呢個叫做 HbA1c。HbA1c 咧就係一個叫做紅血球，叫做 hemoglobin。嘅protein 呢個蛋白，咁咧就幾多個 percent 嘅糖咧黐住呢個蛋白。咁如果你係5.7%咧，咁其實咧正常人啦，low 過5.7就更加好嘅正常人啦。但係多過5.7咧，你就變咗呢個前期患病，去到6.4都係叫做前期患病。當你乜嘢都唔做嘅時候咧，3年裏邊咧好多朋友咧就轉咗去糖尿病㗎啦。咁個醫生都會俾啲時間你咧，係咪可以搞翻你落去一個前期患病咧？如果你做得到，你就唔係糖尿病。但係如果你咩唔做，一去到7咧，醫生就俾藥你食啦，或者上到6.5以上咧，佢都有藥俾你食啊，可能。咁但係當你有呢樣嘢嘅時候咧，你咧就變咗以後都係糖尿病者咯喎。所以變咗嚟講咧，你就千祈唔好去呢個 stage。 我哋希望咧，其實咧都希望能夠好早喺你有膽固醇上升嘅時候，糖開上升咧，已經係開始幫助你咧去建立你嘅每一日嘅習慣啦、食材啦。咁等你咧或者飲去糖茶啦，等你唔會直情都唔跌落去呢個第3期啦，變咗你唔會係永遠唔會去遲期患病，咁啊幾好啊！咁你身體更加健康啦，你個又唔會有好多其他嘅併發症出現啦。哇！呢個係真係一流啦。因為現在嚟講咧，我好多糖友咧，原來依家話俾我聽，其實佢話如果我早啲飲你個去糖茶，我就唔會變咗咁啦。咁其實我哋依家個開始咧，就同嗰啲好多已經有膽固醇 LDL 上升嗰啲人咧，同埋糖開始上升嘅人咧，開始聯繫咧，咁開始諗去糖茶咧，哇，後果十分好喎！佢其實都去唔到，即係佢 A1C 都唔會上嚟嘅，或者佢 A1C 係上嚟啲咁多，跌翻落去5.7以下。咁呢個咧係會更加理想，唔係好似你話，哇，去咗糖尿病我先飲啦，咁你更加弊，千祈唔好做呢樣嘢。OK，so it's so important, a new message now, and I work with so many people. People have said, you know, if I have known myself, instead of actually getting me to really at the time when my not even A1C is 5.7, is actually lower, or even though I come up with a little bit 5.8, I start drinking your tea, and already I got, you know, a slight increase of cholesterol LDL, and I start drinking your tea, and you know what? They will bring the cholesterol back to normal level. Some of them is 120, 130. They drank it, it become 88. So, wow. Then the new message you found that maybe this is even better. When your cholesterol goes up, your blood pressure goes up, you start drinking LOWSUTEA. Then they never get down to pre-diabetic. And rather than you get your pre-diabetic, your diabetes and drink a little bit late. So we'll caught you early, then you can actually prevent all the future potential complication. Isn't that much better and much less problem? I think yes, that is absolutely true. So let's try to do that early during LOWSUTEA, much earlier prevention. And basically how LOWSUTEA work is twofold. One, there's actually one thing in LOWSUTEA has a thing called guava leaves. What it does is delay the absorption of sugar. And then the bitter melon, it helped the LOWSUTEA actually increase the insulin sensitivity. So it took the sugar into the cells, and then eventually excess sugar, they would dump it up on urine, the cholesterol come out in urine, and also the salt dump out urine. And you know, with the salt went down, the blood pressure also come down, plus the detox. So a lot of people actually drank LOWSUTEA, even though they are not pre-diabetic. They said, wow, you know, I felt cleaner, I feel good. A lot of young folks drink LOWSUTEA. You know what? They don't have any more pimple in the face. They feel much better. So these are the kind of things that you want to continue to do that to build your health. That will be so wonderful, right? 嗱，各位朋友，我哋飲去糖茶有咩幫助咧？第一，飲去糖茶原來有兩樣嘢嘅。第一個就係呢個番石榴葉啦。番石榴做咩咧？佢就係將啲糖delay 咗，減遲咗佢入血管，咁你少糖入血管啦。咁但係第二樣嘢就係有呢個叫苦瓜，苦瓜咧係帶啲糖進入去呢個increase 咗個細胞嘅 sensitivity，you know，increase 咗個胰島素嘅敏感度，咁佢就帶翻啲糖咧入去嗰個細胞度。咁同埋仲有咧，佢可能夠將嗰啲糖啦，同埋嘅excess 嘅糖啦，同埋個膽固醇啦，同埋啲呢個鹽啦，就去掉喺個尿嗰度掉出嚟。當你3樣嘢掉咗出嚟嘅時候咧，佢有 detox 啦，降低糖啦，減低膽固醇啦，咁你個人咧就全部個身體咧就更加健康，繼續排毒，哇，幾好啊！所以呢個咧係幫助你降低血糖、膽固醇呢個血壓同埋排毒。So we had talked about earlier, wow, if you don't do anything, what's going to happen? Well, the sad part is if you don't do anything, you're going to have a risk of stroke, you'll lose your memory, And that's happened so many times. I don't know, you have auntie or uncle or grandmother keep asking the same question over again. And you say, oh my goodness, why you don't remember? But you don't really understand. They really cannot remember because the brain is all plugged up. The blood doesn't flow to the area. So they cannot have all the short memories. So they can't even know they ask you the same question. And they might be kind, but just that they can't remember. So I have that same experience with my mother-in-law. She's diabetic. She keeps asking me every 5 minutes, have you eaten dinner yet? I said, you asked me 10 times, 15 times. But she can't remember, okay? So that is a common thing that happen. Your eye become glaucoma, cataract is so common. I have an engineer that is came in and tell me that eyes blur. But actually, you know what, is had diabetic eye already. So we have to send him to the doctor. They were able to save one of his eye. The pancreas malfunction no longer instant come out. But the more important, it affect your heart. That is really important because when you affect your heart, you know what? That can be really detrimental to potential heart attack. And nerve damage can be very, very big too, because what happened when the nerve damage, especially damage your vagus nerve, and you're going to have all kind of guts problem, constipation problem, all kind of problem come along. So, and you cannot feel, okay? So you will not have, sexual function dysfunction because you cannot feel. So all that can be really, can be a serious issue for you. And your blood pressure will go up, remember? And then your blood vessel become hardened as a plugging all the blood. And then if you get injured and heal well, you know what? You have to cut out your foot. And 70% of the patient of diabetes patient have some form of diabetic nephropathy, you know, the kidney damage. So again, that will be really sad because if you get down to 30% of your kidney function, you have to have dialysis. Wow, that will be tremendous effect on your lifestyle and your quality of life. Don't go into the route, okay? And then you have a pregnancy, you have gestation, diabetic, eventually become a diabetic. Wow, you have to watch. So all that complication can be prevented, and you can do it. It's up to you to go for it. And I think you can. If you know the consequences, start now, you will be good. That's why a lot of people want to listen to this webinar, because now they start understand, they know the seriousness of the disease, and they start prevention. 嗱，各位朋友，其實咧，呢個併發症咧係一個好容易出現嘅問題。嗱，當然第一、第二、第3年咧冇乜事發生啊，第5、第6、第7、8年就開始慢慢呢嘢出現啦。咁好多人咧就好快脆咧就開始有即係譬如老啲人家咧，佢會有中風嘅風險啦。個問題咧唔記得嘢啊，呢個是好大問題，因為咧好多糖尿病者70歲啲朋友咧就會 end up 就問你嗰啲問你成日都問你同樣問題，因為佢哋 short memory 嗰個短暫嘅記憶全部唔記得晒啦，已經塞咗個腦塞咗。咁變咗嚟講咧，有呢樣嘢成日問阿仔食咗飯未啊？問咗10幾廿次你好煩啊，其實唔係，因為佢真係唔記得嘅。咁隻眼有青光眼啦，或者白外障啦，同埋個胰臟唔 work 啦，就冇咗胰島素出嚟啦。最大問題咧，40%至60%嘅病人咧有心臟病嘅原因就係因為佢血管係咁塞 ，OK？ 咁啊，仲有神經系統損壞咧，哇！呢個仲弊，因為神經損壞咧，你會 affect 你成個肚嘅問題啦，任何地方嘅神經都會損壞，因為塞啊嘛。咁好多人咧就會 end up 就話便秘啦，嗰個胃唔舒服啦，因為佢個 vagus affect 咗個 vagus nerve 啦，咁好多嘢咧係會繼續嚟嘅。咁同埋仲有咧，你係血壓會高啦，咁仲有咧你血管硬化啦，因為佢塞咗好多血管啊嘛，咁你就要斬埋隻腳。如果你個傷口唔好嘅話，要割咗腳真係幾陰功啊！咁仲有咧就係70%依家嘅病人咧都有呢個腎病嘅問題。咁如果你係去到好差30咧嘅percent function 咧，哇要洗腎嘅喎，即係呢個唔簡單嘅喎。咁同埋仲有咧，就好多人咧就有呢個性嘅問題，因為冇感覺嘛。咁如果你有懷孕有併發症咧，呢個亦都將來變咗糖尿病，係成日都有好多咁嘅人嘅，所以要好小心啊。And our company have 5 programs helping you with diet, exercise, weight control, Dr. Webber, like you listen today, how to measure your blood, will give you all a whole system to help you to continue to better manage yourself. So that will be really wonderful. And what we want to do is we can help you from A1C, even you have 10 plus, doesn't matter, we'll bring it down 5.7. If you are actually even not even to 5. Even you're 6.4, we'll help you become again 5.7. Continue learning how to manage your diabetes. That's our goal. And you can see that, you know, this is what we'll do in here with exercise, weight control, Dr. Webber and so forth. So 我哋各位朋友咧，我哋而家最重要咧就係我哋個5個 program 咧係幫助你咧係由食啦，係有運動啦，又有即係磅重嘅去減低你嘅磅啦，咁仲有聽我哋講書啦，同埋點 track 你嘅 blood 啦，希望你做呢樣。So today we will talk about liver. A lot of people say, why do you want to talk about liver? Why liver is so important? Well, first of all, you have to understand liver is a very important organ. And many of you, if you have liver disease, and usually there's no symptom because it is an organ that continue work on its own, but it's not working, but you cannot tell until you come a very advanced stage. In other words, your liver start really failing, then you can see problem coming in. Especially you are not even drinking alcohol, you have not in such a way that, you know, you have alcohol liver damage, you continue to have type 2 diabetes, and then your liver become hardened, it causes cirrhosis of liver, and then, which is the most common death on diabetes. And usually about 4% diabetic death is related to this cirrhosis of liver. So this webinar will show you all the steps how to protect your liver, so you become a more smarter person, if you will, as a diabetic, and then you don't have to get out to get to that stage. And that's what we're trying to do today. 各位朋友，今日咧好特別咧，就係因為好多人都唔知道咧，原來咧係呢個肝病咧係一個好大問題嘅。點解咧？肝病咧好多人咧因為肝咧係你睇唔到有咩問題出現，多數都係一個即係去到好差嘅時候，你先睇到個病。咁當你有呢樣嘢嘅時候咧，就弊家伙。因為如果你係病好差嘅時候咧，你試去處理咧就好大問題，因為好難處理，其實已經 reverse 得嘅呢啲嘢。咁仲有咧4.4% 嘅糖尿病病者咧有肝嘅嚴重問題，令到死亡咧係達到4.4% 嘅，所以都幾高㗎，4.4低㗎嚇。咁所以希望咧你唔會去到呢個地方啦。所以今日咧就俾 tips 咧能夠幫助你咧係保護你個肝，咁你變咗能夠繼續咧可以身體健康，唔會有任何嘅問題。Okay. Now, one of the interesting thing is if you have not drank alcohol, it will not damage your kidney, liver, isn't it? But on the other hand, if you really do not well control yourself in your diabetes because you're diabetic mellitus already, and I'm obese, and I have also tremendous amount of lipid all over the liver, and become, you know, a fatty liver issue, and with that will carry you become a cirrhosis of liver. In other words, liver will harden, and eventually then you might even have several things will come in, your liver start damaging, and on top of that, you might have also forming liver cancer. Okay, so this is the kind of typical progressions of your liver problem. Two major things you have to really watch is one, obesity. In other words, you are really fat or big, and you have tremendous amount of not controlling your diet. You have eat all kind of fats in your system, so your liver really have a fatty liver problem. So this is the kind of thing you add it together that's move you to the cirrhosis of liver, and eventually there's also potential cancer of liver. Now, cancer of liver is another total different story. You know what I mean? That's a stage, right? So you really want to stop yourself become cirrhosis of liver, because that is the liver become hardened and is not going to function well. You want to even stop over there. You don't want to get there, okay? You want to prevent yourself getting become cirrhosis. That's what we try to give you on the tips, okay? 嗱，各位朋友，因為咧如果你一個係 Type 2 diabetes 嘅人咧，你會係好多時咧，你唔飲酒，但係你嘅 liver 點解會壞咧？就好多時咧，就因為我哋依家第一糖尿病啦，咁已經係好多 issue 喺個影響個肝嘅問題喎。但係呢啲人咧，多數係點啊？多數肥胖嘅，係好 overweight，咁即係大家 BMI 過30啦。咁仲有一樣好大問題咧，呢啲人咧多數係有個叫 fatty liver， 即係好多 lipid， 好多肥脂肪喺個 liver 度嘅。咁兩樣加埋咧，咪啦，咁就會變咗一個肝硬化嘅問題出現。當你個肝硬化問題出現咧，咁啊另外一個即係層面會出現咧，就係咩嘅咧？就係呢啲人咧繼續咁落去咩都唔做嘅時候咧，佢可能咧仲有一個咧就係肝癌嘅出現啦。OK， 咁呢啲我哋希望各位唔好搞到肝硬化先去處理啦，因為如果肝硬化係好難搞嘅，即係已經係去到嗰個 stage 你翻唔到幾多轉頭嘅。所以希望你各位知道咧，就係 prevent 到你唔好去肝硬化，因為再肝硬化之後咧就有 cancer 啊啲咁出嚟咧，咁就真係好麻煩啦。OK， 咁啊盡量咧係能夠令到你個肝唔硬化，點去保護你個所以你個 liver 啦。OK， 嗱記住 ，so really the stages of liver damage is first you have a healthy liver, you're doing okay, but then you start getting your liver become, with all sort of diabetic coming in, and you start doing, not quite cirrhosis liver yet, but you are really getting a lot of fat to the liver, and so forth and so forth. Now, but not quite to cirrhosis. All that you can reverse. In other words, if you can control your blood sugar, control your fat intake, then you can do better to able to prevent your basically your liver damage. Okay, you don't want to get yourself all the way to liver cirrhosis. Okay, that will be no good for you. Okay, so before you get to the liver cirrhosis, you can have actually reversible, you could have reversible your liver damage. OK， 嗱，各位朋友記住，當我哋有呢個liver damage 咧嘅時候，最重要了解到係咩咧？就係你最重要了解到嘅時候咧，你個 liver 如果係糖尿高咗上去，你好多 fat， 咁但係未到呢個肝硬化，咁你係有機會咧係 reverse 到你嘅肝嘅問題嘅。咁最好咧，你真係盡量啦。如果你係可以去到喺呢個 stage 嘅時候咧，你唔係搞到個肝變硬化咧，你呢個就真係可能夠去翻個 healthy 肝，因為肝係好好嘅，因為有咗 healthy 肝咧就冇好多其他問題出現。千祈唔好去到呢個 liver cirrhosis 即係肝硬化裏面咧，你就唔好意思啦。呢個咧就真係咧係轉變唔翻轉頭嘅。所以記住，其實喺呢方面，我哋而家盡量喺呢方面咧係幫助你咧，唔好搞到自己係肝唔會去到硬化嘅情況啦。So what our tips basically today to help you to focus is to what is the tip to help you to prevent your liver becomes cirrhosis. Prevention of liver cirrhosis is our goal today for you. Okay. Now, how that done? Remember, the first thing that most likely these people will have very much called obesity. You know, where they are overweight, they eat a lot of high cholesterol item, fatty product. So really, at the end of the day, that's really the first stage. You need to stop to getting yourself this overweight and fatty diet. Because when you have that, that is continue to damage your liver, right? So to maintain a healthy weight is number one tip to prevent liver damage. So remember, when you're obese, you actually also make the diabetic become harder to manage. It will also start contribute factor that will get fatty liver disease, and which you'll be excess building fat to your liver, which is now because of that, you increase the chances of cirrhosis of the liver, and then potential even liver cancer later on. Okay, so the important thing is, if you only lose 5% of your weight or even 10% of weight, you will actually already significantly improve your diabetes. Remember, if you get 10%, you already drop 1 point of A1C. Wow, that's wonderful. And that result, you get able to decrease tremendous amount of diabetic risk already. Okay, so really depends on how you're gonna like exercise, a diet, that you can able to work together, and your weight. If you can do all that, for sure you can help yourself prevent the liver damage. And that's the key message here. Number one, maintain healthy weight. 但各位朋友，其實好簡單嘅喎，真係，因為如果你係已經控制咗你磅數，第一，你肥胖可以減低肥胖，因為當你係能夠減低你肥胖嘅時候咧，你亦都控制到咩啊？你個糖尿病嘅問題。因為當你唔係咁多糖，你都唔係食咁多脂肪，你減低嘅肥胖，你個 fatty liver 即係你個肥肝啊，咁已經係減低咗啦，咁就唔會有好多肥嘅東西喺呢個肝個 build up， 咁你已經係降低咗你個肝硬化嘅問題咧，同埋 eventually 亦都降低咗你個 cancer， 即係呢個肝癌嘅風險咯。咁第二樣嘢咧，當你係減咗10% of 你自己嘅磅數咧，你係能夠降低1% 嘅 A1C， 或者如果5%你0.5% A1C 咧，哇！咁亦都幫助你係減低你好多糖尿病嘅風險喎。第三，如果你個 weight 係繼續係降低嘅話，當然啦，你要做 exercise 啊，做 diet 啊，即係食飯啊，咁同埋你啲食物唔好肥嘅東西咧。咁其實呢啲嘢全部咧幫助你 overall 一個好健康嘅生活啊！呢個係好 natural 喎，係咪？咁係容易做嘅。咁但係你記住第一個 point 就係個磅數要管理啦。So the first tip we will teach you about is maintain a healthy weight. That is the number one, prevent your liver damage. Okay. So we talk about diet, right? So what do you mean diet? So the liver diet is very simple. You have to have better diet to help your liver become more healthy. It's the same thing what we do in diabetes. You have to have fruit, vegetable, high fiber plant food to eat. You want to reduce high food beverages with high sugar like soda, Cokes. You want to decrease the salt intake. You don't want to do refined carbohydrate, saturated fat, low calorie diet, and avoid what? Alcohol, okay? And then drink LOWSUTEA 8 cups a day. And then you can pre and post meal each time. And also with that, you also need to lower your body weight through exercise and so forth. But the diet, if you can able just use a diet control, low calorie, you know what? You're lower calorie, you definitely can lose weight. I'll give you some example. One of my customers come in, he said, Andrew, I have a problem. I have now 200 something pounds. It's 210 pounds, I believe. And he said, I couldn't lower my weight. Well, I said, what have you been eating? Well, I eat the same old thing. So I said, gee, when I start looking at that, what he ate, it really can be an issue because he hardly touched a lot of vegetable. He ate a lot of meat, red meat, that is. And basically a lot of fat. He liked char siu, Chinese barbecue meat. He eat a lot of Chinese whole chicken, and all of fat in it. And every day he ate pretty much the same thing. He loved that kind of food, but no vegetable. So I said, look, you got to really cut down that. So I suggested a lot of vegetable, half a plate of vegetable. Now start introduce what? Fish. And he said, I don't know, I eat fish. So I start getting him to eat salmon, cod, and all the good stuff. So he just changed diet in a sense of, the vegetable. And instead of cutting a lot of meat, I just put down on dieting as like fish, like salmon and cod. And the rice, I told him to cut down the rice because, the rice is not going to help you a lot. So he started eating basically beans and also brown rice. And you know what? His weight after, now also I did suggest some exercise, but his exercise is very moderate, I think. He hardly walked basically, but he actually now ended up to walk half an hour in the shopping mall with his wife. And with that, after 3 months only, he lost about 5 pounds already. 5 pounds. And he thought that, wow, amazing. Before I never get it. But with this, he started encouraging himself with the dieting, little exercise, and you know what? His weight started coming down. Plus, he started drinking LOWSUTEA. So his blood sugar also coming down. So all that come down. So it's not really hard, basically changing some of the diet and also the calories, because you have to really go down the calories. You got mention if you got 1,500 calories and 200 or 150 grams of carbs, I'm sure with that you can lower your weight tremendously. Okay, so keep that in mind. 1,500 calories and then 150 grams of carbs, you will do that real well. Okay, just try that. It doesn't take a lot of effort, but when you try that, the calorie go down. You will start seeing the effect of your weight start going down, and your fat also go down. And my friend become a lot more. The comment about them is that, Andrew, I now feel like lighter. I like more energetic. Walking with the wife, and even 5 pounds, they felt very, very good. So now he is so encouraged to continue. Okay, the key is continue. Now, then you have exercise regularly. Okay, we'll talk about the second point now. The first part is weight. Second point is your diet. Now you have to regular exercise. The exercise is 150-minute exercise per week, and then you have to have at least 30 minutes of moderate exercise like walking, bike riding. Doesn't matter. Anything you want to do. And you can have doing a bike riding or going to Step Master, that's okay. But the 30-minute become an important exercise. And so my friend, what he did is actually all he does is go around walking shopping mall. And that's all he does. And that result, he was able to achieve his 5 pounds within 3 months. Wow, that's really good, man. And he was really felt that he was good and wonderful. OK， 嗱，各位朋友記住咧，我哋頭先講咗咧，好簡單嘅就係第一，你個磅數要減磅，要減磅。咁點減磅咧？就一定要做如果exercise 啦、diet 啦。咁其實我都講咗咧，如果 diet 咧好重要咧，就係食大概即係多啲 fibre 啦，一半係菜啦，食多魚啦，唔好食肉啦。同埋咧食啲低卡路里嘅東西啦，同埋咧飲去糖茶啦。咁我朋友咧，其實咧有個朋友咧，就佢只係做咗3個月嘅時間去減佢嘅磅嘅啫。咁佢3個月磅係點減啊？原來好簡單喎，佢介紹好中意食肉啦，食好多飯啊嗰啲東西啦。咁我叫佢減咗啦，佢就淨係食菜。然後咧就食魚，魚有2種魚佢食嘅啫。其實佢食個三文魚啦，或者食個 cod， 即係石斑啊啲白嘅魚啦。咁其他咧佢就依家食紅米啊 brown rice。咁變咗嚟講咧，佢就可能夠將所有嘅東西咧就減咗之後咧，咁仲有咧佢個卡路里每日係少過大概1500嘅卡路里，再加150 gram 嘅碳水化合物食物，咁同埋咧佢每日咧都行30分鐘喺個 shopping mall 同佢太太行散步。 整完之後佢減3個月後咪減5磅，同埋佢個身咧健康咗好多。咁繼續努力呢個咧，我覺得係一定做到嘅。OK。So the other one now we'll talk about going down to weight, going down to diet. Now we're going to exercise. Now the fourth tip is lower your lipid level. How do you do that? Okay, that is important because you know why? Your cholesterol, your triglyceride, if you're not controlled, then you can really, especially you do all kinds of saturated fat that you eat, and also sugar, all that will go into your triglyceride because all the additional fat that you accumulate, you go in triglyceride, it goes up. And when it goes up, oh my goodness, your LDL mostly goes up, your HDL mostly go down. So with all that, you got to eliminate all those sort of saturated fat. One of the good things that my friend also told me, he used to love to eat hamburgers, fatty hamburger. He loved that stuff. I said, you got to cut that off, my friend. The red meat is really not so good for you. So he started cutting off the hamburger instead of using fish, like the white fish or salmon fish, and adding on his salad. Now, it did take some cooking, take some doing, because you know why? Not every people from Hong Kong, Chinese, actually like fish per se. Matter of fact, it was a little bit against the eating salmon fish. But I said, you know what? Just pan fry without oil. Or if oil, just put some olive oil. And after he did that, you know what? He started getting used to it. He said, wow, I didn't realize fish tastes that good. and then he started getting some of the, and we asked him to add spice like garlic and things like that instead of eating a lot of salt. With that, he really able to change his diet from not very healthy food like hamburger, steak. He really able to cut down all these red meat and change to fish and salad and stuff like that. He loves it. And now suddenly he's drinking LOWSUTEA 8 cups a day, pre and post each meal with 250 ml of LOWSUTEA. And he said, really now I actually drank the tea first and I eat. Actually, he started eating less because the tea filled his stomach. And that result, he don't feel hungry anymore. And so with that, he will also continue to lower his body blood lipid because he no longer eat those red meat, fat, good stuff, right? One of the good things he also do is I suggest to him is that on snack, try to eat, the celeries, and he chew on his celeries. And so that result also, he is able to lower his snack intake, like cookies, cupcakes, and stuff like that. That's what he used to do. So all that lower his blood lipid level tremendously, and it's really a marked improvement. But importantly is you really have the diet, exercise, and also continue to work with your doctors. Your medication is okay the same. You tell them that that's what you're doing. And usually the doctor are pretty much, you eat whatever you're doing good, they will let you continue to do that, okay? So do check with them though. But drinking LOWSUTEA is important at the same time, lower your blood lipid levels. So that's really important. Now, 各位朋友記住，因為咧好多人咧唔知道原來你嘅 cholesterol 高咧，食好多呢啲咁嘅大高脂肪嘅食物咧係對你認真有害嘅。OK， 嗱我朋友好中意食 hamburger， 好中意食 steak 嘅紅肉啊 steak 啊牛扒豬扒全部中意嘅。咁啊最弊咧食咗呢啲咁嘢咧，佢個 cholesterol 亦都上升啦。你知 cholesterol 上升咗有咩問題啊 ？damage 咗 B cells 啦。當 damage B cell 咪帶唔到糖入去血管裏邊啦，咁你就會腦肥胖喎，有脂肪肝又會嚟咯。咁但係佢減低咗呢個食 hamburger 紅肉嗰啲東西咧，其實我依家仲係食魚咧，佢都要一段時間習慣嘅，因為佢要話哇，其實我唔好少食魚喎。咁佢依家食咗係咩啊？係食 三文魚啦，再食嗰啲叫cod 啦，咁佢依家食嗰啲石斑魚啊嗰啲，原來佢都要時間去適應嘅，因為佢如果煮嗰啲東西咧，佢未食慣嘅時候咧，真係好，佢話我好少食魚嘅，咁但係當佢食咗之後咧，佢話好食喎，咁同埋佢依家唔食咁多紅肉嘅時候咧，佢亦都降低糖嘅吸收啦，咁其實亦都啲肥脂肪吸收啦，咁佢降低咗佢血裏邊嗰啲肥嘅膏啊，咁變咗就好重要嘅，變咗佢個 triglyceride 三脂油甘油脂亦都降低咗啦。咁仲埋一樣咧，佢飲好多去糖茶依家，咁佢 definitely 咧，呢個亦都幫助佢降低咗佢嘅cholesterol 啦，咁亦都降低佢血糖啦。咁幾樣好埋晒咧，佢就話：哇，我覺得舒服咗嘅人。OK，咁當然啦，你就要係繼續同醫生溝通啦。你食咩好啊？嗰啲呢個好重要啦嚇，因為唔可以就即係唔同溝通，自己做咗，醫生唔知嘅。要話俾你聽，咁多數醫生咧都，如果你係做啲嘢 work 嘅話咧，佢都係俾你繼續做嘅。So besides what we talk about so far now, we have also got to lower your blood pressure. I don't know, many of you go to see a doctor, they always measure your blood pressure if you have diabetes, and they say, hey, you can have all over 130. And the good old days, I thought, wow, hey, you know, wouldn't be me is I can have 140, 150. The new rule is not. You got to go down to below 130, okay? And so that result now, you should be about 120, and your systolic pressure is 120 and lower. That's your target. And your diastolic supposed to be 80 and lower, okay? So don't mix up. No, there's no confusion. Is now the new rule is you got to be 120 lower, not 150. You have to be 80 and lower your diastolic, okay? So keep that in mind, and you really have to lower your blood pressure. When you lower your blood pressure, you know what? You'll be much healthier, have less chances of heart attack and all the problems that will come along, and plus stroke and so forth. Diabetes really have to do that because a lot of time is your nerve has been damaged, your vessel has been damaged, your blood pressure could be potentially go up. Remember one of the stage? So in order to do that, you have to lower your blood pressure. Now, a lot of people say, how do I lower my blood pressure? Well, first of all, you got to cut down your salt intake of your food. Secondly, you have to healthy diet, and you have to exercise. And exercise will help you lower your blood pressure. Because when you exercise, you relax your blood vessels start relaxing. And also when you exercise, you get rid of all the potentially you do have plaque, they will all soften up, your vessel becomes softer, and that result, you know what, your blood pressure will go down, and that will be wonderful. Okay, now in addition to that, you have to quit your smoking. You don't smoke because that also increases your blood pressure. You gotta get good sleep, and you have to reduce stress, and then you have to continue to measure your blood pressure in the morning and at night after you go home, sit down, relax. And then you guys measure your blood pressure and see before you go to sleep, what is your blood pressure? You document it, write it down, write on your phone. And then you can show the doctor and say, hey, my blood pressure at home is about 125 or lower or 120. Get your target to be 120. If you exercise, I can guarantee your blood pressure will go down. Very important. That's why the exercise is one of the important things to get your blood pressure to improve, okay? So, and certainly your diet gotta be eliminate much of the salt because your food itself has salt. So eat more garlic, spice, but cut down the salt. Then you cut down the salt, you are much better off your blood pressure because you lower your blood pressure, you're better off preventing a stroke or heart attack or other serious issue. Okay? 嗱，各位朋友，好重要咧。你要降低你嘅血壓啦，咁有啲人話點解降低血壓？我130幾喎，140幾唔係咁嘅咩？梗係唔係啦，因為血壓咧就一定要係喺咩啊120底下，呢個就新 rule 嚟嘅，即係新嘅target 120，上壓係120以下，下壓咧係80以下，咁你就繼續咧身體健康啦。所以呢個好重要咧，就係你點爭取呢樣嘢咧。咁第一。 你食物就冇咁多鹽啦。第二要係咩？運動啊！當你運動嘅時候咧，你將你血管咧係已經軟化咗佢啦，咁令到你血壓就會降低嘅。咁同埋仲有咧，你要係點啊？唔好食煙啦，仲要瞓覺瞓得好啦，唔好減低你壓力啦，工作壓力啦，同埋每一日都要 measure blood pressure， 係朝頭早起身嘅時候咩情況，然後放工翻嚟臨瞓之前 measure 嘅血壓係點樣？咁你要靜啲先咧 measure 喎，你唔好話哇我跑完先 measure 咧，咁啊唔準嘅 ，OK？So don't measure your blood pressure after you just finish running because that is not going to give you a good indicator. Also, always rest after 20 minutes. Then you measure your blood pressure in a quiet environment. Then you know how your blood pressure is going. Rather than you after exercise measure your blood pressure, wow, my friend, it's not going to work because that will be high. Okay, I can guarantee you. So remember, make sure you measure your blood pressure. Below 120 on the systolic scale, and measure blood pressure diastolic is under 80. Okay, so this is sort of the new standard now for diabetes. So make sure that you are continue to do that. Now, even you have 130, but not over 130. So keep that in mind. Now, a lot of people don't realize actually drinking LOWSUTEA becomes very important because when you drink LOWSUTEA, it actually helps you several things. First of all, you lower your blood sugar level because definitely if you drink LOWSUTEA, if you continue to drink, you can see your blood sugar level coming down. And a lot of people actually, if they don't drink, you know what? The blood sugar going up. One of the good example is one of our clients, Faye. She forgot her LOWSUTEA, your blood sugar will go back up. Okay, as simple as that. And this is not only the person, every single people also tell me the same thing. Well, I didn't drink my LOWSUTEA, my blood sugar go up. How come? Because LOWSUTEA have that secret function, have you delay the sugar absorption of vessels and also increase the sensitivity, the guava leaf, to take the sugar into the cells. And on top of that, excess sugar will dump it up, and urine and your cholesterol dump it off, and your salt dump it off, your blood pressure come down. So it definitely helps you lower blood sugar. It also helps you lower what? Your bad cholesterol, LDL. It will go down. And with that, they also, because the salt go down, your blood pressure will go down, and it really support your whole cardiovascular health. So you have, because all the blood pressure go down, cholesterol go down, sugar go down, your heart health is better, and also a detox because you make a lot of shishi. And remember, everybody say, hey, I drink a lot of shishi. Well, that's good for you because you lower your blood, detox you all the time. And you detox the body naturally. Because LOWSUTEA is not a drug. It's just only a supplement, a diet supplement. But it has its function, help you do all that stuff, lower blood sugar, lower LDL, lower cholesterol, lower your blood pressure, and also detox. And that is wonderful, okay? It's give you healthy. 其實飲去糖茶有咩作用咧？第一，去糖就幫助你咧係降低血糖，呢個好重要啦，已經大家都知嘅，一定知啊。如果你唔飲個血糖會走咗上去嘅。第二樣降低咩啊？膽固醇啊，壞嘅膽固醇，呢個係好嘢嚟嘅。因為壞減膽咧，咁就降低咗你心臟病啊其他問題啦。第三，降低咗血壓，同埋咧仲有當你排毒，呢啲嘢全部咧係幫助你更加身體健康，同埋你心臟病啊其他咧都要全部係可以降低到嘅。咁你話幾好啊 ？So when you also when you visit a doctor, you have so also when you visit a doctor, you also need to check besides your blood sugar, your kidney. One of the things you also need to check is your liver. Does it have any liver disease? So you really, if you basically check, usually there's a test, blood test called liver enzyme test. So if you can do that, that usually a very good way to understand where you're at. But because the problem is liver disease doesn't show any sign and symptoms. There are usually no sign and symptoms. By the time the signs and symptoms show up, you know what? And you really have a serious problem already. For example, you're gonna appear with jaundiced eyes, your skin becomes yellowish color, you have abdominal pain, you swell, your leg, ankle will start swelling, you have itchy skin, you have dark color urine, your stool become kind of pale color, and basically it could be even not brownish color at least, and you have blood in stool, you are very tired all the time, you feel nauseated, you feel throwing up, you have no appetite, and you have easy to bruise yourself. You know, when you hit yourself, you start bruising, okay, and start bleeding. So all that are considered start seeing more serious liver problem. So really at the end of the day, when you go see a doctor, make sure you check, ask the doctor, hey, how's my liver? Now, if they suspected you have liver problem, they usually also do one more thing, ultrasound examination, see your liver become bigger, or they have cirrhosis of the liver, they usually check that. But a lab test usually is called liver enzyme test. We'll be able to do that. So I hope none of you guys will end up with that kind of these sign symptom as jaundice, pain, swell pain. So all those I hope is not there. So you will not get into serious issue, because when you get down to that, you already start getting to a stage of cirrhosis of the liver. That's all these going to come in. So hope that you don't get into that stage. Okay. 嗱，各位朋友，如果你去見醫生嘅時候咧，當然啦，你係糖尿病病者啦，咁好多時你第一定 check 你血糖啦，第二 check 你嘅身體嘅嗰個 kidney 啦，即係你個腎啦，有冇問題啦？咁佢有多數做一個叫做kidney 嘅 function test 啦。咁第三咧就係要睇下你個 liver enzyme test， 即係你個 liver 係咪有問題？咁呢個係個血即係做個 blood test 嘅程序嚟嘅。咁如果你真係有問題咧，醫生會做個 ultrasound 睇下你個 liver 咪大咗啊，或者呢個硬化，咁呢個係 ultrasound 做出嚟。但係當你有其他問題已經出現嘅話咧，好似眼開始黃啦、黃疸眼啦，啲面色變咗橙黃色啦，咁同埋咧又有肚痛啦，同埋你個腳咧腳眼開腫咗啦，啲身體亦都好痕啦，同埋咧你尿道咧係全部係好黑咖啡黃色orange colour dark orange 嘅，係即係深橙色嘅。咁同埋咧，你嘅大便咧唔係黃色黑咖啡色喎，就係好似灰灰地嘅。呢啲嘢係全部有問題出現咗㗎啦。咁你同埋咧，仲有血液喺個即係血喺個stool 度啦，即係你血喺嗰個大糞便裏邊啦。咁仲有一個好常見嘅人咧，就係佢好攰。呢個人一定係如果有腎病有肝病嘅人咧，係好攰嘅，同埋會作悶作嘔啦。同埋冇晒胃口啦，咁同埋咧，仲有咧就一個好簡單咧，就撞到嘢佢就即刻流血，咁嗰度咧就會一個變咗全部好似腫咗啊，同埋一笪血喺度淤咗嘅喺個身體度嘅。咁當你有呢啲咧，你就真係快去見醫生，即係話你個肝咧已經係去到一個係好差嘅 stage 嘅，就唔係一個好嘅 stage 啊。So make sure that when you take a picture of this, by the way, if you really see those signs and symptoms, that means you have a pretty bad approaching not a good stage of your liver issue, and you should quickly see a doctor to control your liver disease damage. Okay. So in summary, as you know, when you have liver disease, usually is a issue that you might not see the problem until the late stage. But on the other hand, for type 2 diabetic, it is a common complication, and majority of people don't even know until it gets worse. And 4.4% people who have diabetic has related this liver disease. and they can die because of that. Okay, so you got to be careful. Make sure you do not get yourself get very bad into that stage. Now, in order for you to really do good, is one, you have to maintain your weight. Okay, your weight has to be doing good. Second, you have to have a good diet plan, so you can actually make sure that you have 1,500 calories, and then another 150 carbs, gram of carbs to take. So when you do 1,500 calories and 150 gram of carbs, I'm very sure if you a little more exercise, your weight will go down. And if your weight go down just 5 to 10%, it will help you on your A1C. It will help your liver. Don't get all the fat in there. That will be wonderful. So you'll cut down your fat, more food with fibers. Instead of red meat, you eat more fish. And instead of eat rice, eat beans, and also brown rice, more fiber type of stuff will help you to maintain a better diet. And you have to do your exercise. As I mentioned, 150 minutes per week, and at least 30-minute exercise per day. And then you have to lower your blood lipid. Blood lipid, basically the way how you do it is cut down the fat intake, not going to McDonald's all the time, cut down your fat. And then you have to reduce your high blood pressure by have better good dieting, exercise, lower your stress. Then that result, your blood pressure will go down. If you exercise, definitely if you exercise, for sure your blood pressure will go down, because it relaxes your vessels, and it will become less, your muscle be hot, your blood vessels be hardened. So that result, you will lower your blood pressure. And today target blood pressure is 120/80, not 140, not 130 above. If you do 130, is margin already. You have to go back down to 120. Okay, and you have to be under 80. So 70 is okay. So that is your new target. Certainly, you have to drink LOWSUTEA per day, 8 cups, pre and post, each meal, pre and post. And that result, that will lower your blood sugar, cholesterol, and also your blood pressure and detox. So that's right. Drinking LOWSUTEA is so good. You hit 4 items, all the things you need: lower blood sugar, lower cholesterol, lower your blood pressure, and at the end, detox. Wow, isn't that great? And certainly, if you see sign and symptom of liver disease, you better go ask your doctor. Hey, what happened, man? I got pain here. I got cherry yellow, jaundice face, all that issue. You got to get help as soon as you can. Okay, I hope that will give you a very good insight how to protect your better liver. 嗱，各位朋友，今日咧講得好簡單，但係好容易做嘅東西。每個人都要咧係好保護個肝嘅，因為咧如果你唔保護肝咧，好多喺糖尿病病者有4.4%嘅糖尿病病者就會死咗，變咗好慘喎。咁你一定要點樣能夠保護肝啊？咁保護肝好簡單，就係你係能夠要即係你個磅數降低啦。咁你個 diet 方面咧就食啲嘢咧就1500個calorie 啦，或者係150 gram 嘅碳水化合物啦。要做 exercise 啦，每日做30分鐘，一個禮拜做150分鐘啦。咁啊降低咗，你會降低你自己嘅磅數，同埋亦都降低將你因為你 exercise 咧，咁你血管又唔會咁硬化啦。咁仲有咧就要降低你嘅血壓啦。咁你 exercise 一定會降低血壓㗎啦。咁要降低啲鹽嘅食品啦。咁仲有咧就要飲你嘅去糖茶啦，飲8杯咧就會身體更加好嘅，因為你去糖茶有4樣嘢都降低嘅。第一，幫助你降低血糖啦，幫助你去減股醇啦，當緊你個血壓啦，再係降低排毒。哇！真係開心啦。咁仲有咧，如果你有真係有好多不同嘅現狀出現咧，好似肝硬化嘅症狀出咧，快去睇醫生，睇下點能夠控制到呢樣嘢。Okay, so I hope today the lecture will be good, give you a good idea how to control your liver damage, and make you sure a healthy liver, because liver is definitely a very important organ. And I hope that you will be always keep yourself healthy. And really everything seems to be related. It's very simple to do. Only thing is up to you to go get it. And if you can do it, you know what? You'll be so healthy, live happier, and become a long life. Enjoy your grandchildren and lots of energy. Okay, I wonder any other question from the group? Maybe I could help to answer. And it'll be really cool if you can do that. If you have any question, please write to me also. This is my email address here. You can write to me. I could help to answer your question, and we'll go from there if you need any additional help. So any other question from the group? I hope I can give you this insight. And if you any question I could answer, that would be wonderful. Okay. Well, if there's no question, I appreciate, thank you very, very much for joining our webinar on the actual how to prevent liver damage. And I know you guys are busy, and it was so good that you helped you around to listen to our webinar. And I hope that you continue to be healthy and continue to drink LOWSUTEA, helping you to lower your blood sugar, cholesterol, blood pressure, and detox. Okay, thank you very much. Goodbye. Bye-bye.